So I will be doing a video on oral cares for mechanically ventilated patients that are on invasive ventilation, so they do have an ET tube. So we're going to do oral cares for these patients every 2 hours to help prevent ventilator-acquired pneumonia. So you want to knock, enter the room, and introduce yourself. You need to wear appropriate PPE, and of course wash your hands before you apply PPE. Gloves is always necessary. So we have this piece where all of our attachments are going to attach, and this side will attach to the wall suction at -100 to -120 for our suction pressure. So the first thing that we're going to do is attach this suction catheter, and this is going to help us suction out the mouth of our patient beside the ET tube and kind of get those pockets where saliva and other secretions sometimes sit. So we'll go ahead and we will do suction in the mouth for our patient. You want to make sure you're covering this back up to prevent any contamination, just to help kind of keep it clean there. So the next thing that you're going to do is attach the toothbrush, and the toothbrush has sort of a toothpaste type of agent. So the toothbrush will attach, then you'll get some of the toothbrush agent on there. Toothpaste agent, you're going to brush the teeth. So you're going to brush the left side, you're going to brush the right side, the top teeth, the bottom teeth, the inside surface toward the palate, the outside surface of the teeth. You want to make sure you're getting the molars. You really want to make sure you're getting all surfaces of the teeth, and you want to make sure that you're not being too gentle but also not too rough. We want to get the teeth clean, but we don't want to hurt the patient. So once you've gotten the teeth clean, then we'll go through again and suction out any of those secretions or saliva that may be in the patient's mouth. After we've done that, we're going to go ahead and apply a mouth moisturizer to the patient's mouth. We're going to get their cheeks, their tongue, the roof of their mouth. We want to get their gum line. We want to get all of those internal surfaces of the mouth as well as the lips. So then in 2 hours when we come back again, we're going to use this longer catheter, and we're going to suction deeper down into the patient's throat where they aren't able to expectorate or cough that stuff up. We're going to use this type of catheter to get that out of there for them. So we're going to go ahead and suction that those secretions out for the patient. And then the last thing that we're going to do is after the next 2 hours is we're going to use this sort of like sponge brush, which functions very similarly to the toothbrush. You're going to dip it into this oral debriding agent, and you're going to clean the inside surfaces of the mouth. So you want to get the cheeks, the tongue. You want to make sure that you're getting, you can go over the teeth, you want to get the roof of the mouth. You really want to get all those internal surfaces of the mouth clean. And then once you have that clean, you'll just use this switch and you'll turn the suction on so that you can suck those things out. You really want to make sure that the suction's not on while you're doing the cleaning, otherwise you're just sucking up this, the stuff, the agent that you're using to clean, and you're not really getting the best job done. So once you've cleaned, then go back and turn on the suction and suck that all back out of the patient's mouth. And then we want to go back through again, and we want to use the mouth moisturizer. We want to use it on the internal surfaces of the mouth, just like before, the cheeks, the tongue, the gums, the roof of the mouth, as well as the lips. And then before we go, we want to check the ET tube again. We want to make sure that it's not damaged in any way. And we also need to use this time to check the skin integrity of the patient, to make sure that they're not getting any type of sores where the ET tube sits.